Welcome back to the Waco Family Medicine Point of Care Ultrasound Curriculum. I'm Dr. Ryan Trantham, and in this module, we're going to be exploring the world of vascular ultrasound, which combines the skills we've already learned from our other modules with some more advanced applications of Doppler ultrasound technology. My goal is to give you an overview of physics that's important to the understanding of vascular studies, a tour of some different clinical applications for duplex studies, and instruction on particular exam protocols that can help us answer common questions that arise when managing our patients in the clinic or at the hospital. To make a complex topic quite simple, we typically use vascular ultrasound to accomplish a few specific tasks, which are broadly listed here. Firstly, we can use a 2D or duplex image to identify and localize vessels that may be targets for canalization or that we want to avoid when we're doing a procedure on a patient. Sometimes we use ultrasound to find otherwise difficult to palpate pulses or to assess the adequacy of chest compressions during cardiac resuscitation. Secondly, we can use our Doppler measurements to help characterize intravascular flow, essentially to ask the question, does this patient have impaired blood flow due to upstream or downstream blockages or to venous congestion? So whether we're thinking about peripheral arterial disease or looking for DVTs, we can use vascular ultrasound techniques to tell us what is happening inside the vessel of interest. And lastly, much attention is paid to vascular ultrasound's ability, or inability, but we'll get into that later, to tell us about a patient's overall volume status or help guide our decision-making when deciding if we should push fluids or diurese a patient with conflicting lab or clinical appearances. As a general rule, blood vessels should be easy to see when using ultrasound, because they're typically anechoic, they're in anatomically predictable positions, and they light up on color or power Doppler flow. However, using some more advanced Doppler measurements to draw conclusions about the possible pathologies that might be present can be a much more difficult task. Before you decide to dive into this module, you should have a good grasp of basic ultrasound physics and terminology, and give yourself some grace to struggle the first few times you attempt these exams. They're not super easy. Why is the interpretation of vascular ultrasound a complex task, you ask? Well, it depends on knowing a fair amount about the things we were taught in medical school, but that we don't need to recall as frequently as our surgical or more procedural colleagues. How many major branches are there off the abdominal aorta? What veins merge to form the popliteal vein? If you have to take a refresher on some of these anatomy lessons, I promise you're not alone. Furthermore, for each of these vessels, there are different patterns and parameters of blood flow that vary from site to site and from person to person. And understanding the normal physiology and ultrasound findings is imperative before attempting to identify anything abnormal. Then, once pathology is suspected, actually manipulating the image and the probe and the machine to obtain adequate views and measurements is a challenge in and of itself. It's further complicated by recognizing how these measurements and findings apply clinically and how to manage the resultant diagnoses. It's hard, okay? But it's my goal to make it as simple and clinically applicable for you as possible. To that end, let's review some basics of the cardiovascular system. The cardiovascular system can be broadly divided into three silos: the arterial system, which carries blood away from the heart to the rest of the body, capillary systems where metabolic exchange occurs, and the venous system, which shuttles deoxygenated blood back towards the heart. In general, the arterial system is a high-pressure system with variable resistance depending on each arterial's destination and course through the body, whereas the venous system is a low-pressure system that is highly compliant and accommodates blood passively, making it prone to dilation and congestion. Normal blood flow in vessels is typically described as laminar. Fluid physics purists may also say that this is an example of plug flow rather than laminar flow, but for our purposes, we'll think of it as laminar. This means that the blood proceeds forward in a linear, non-turbulent pattern at roughly the same speed. We know that due to drag and other physical forces, the cells that are along the periphery tend to move a bit slower than cells in the center of the vessel lumen. But the idea here is that flow is ordered, linear, and with a low variance of individual cell velocities. So if we applied some very amateur animation to our hypothetical vessels, you can see that the blood moves in a more or less ordered manner. When flow is disrupted, such as due to intraluminal narrowing from atherosclerosis or thrombi, or due to kinks or anatomical changes in the vessel due to positioning or aneurystic changes, this laminar flow is disrupted. Just like a river becomes turbulent at rapids, the blood flows turbulently through and around these areas of blockage. While some blood will move quickly through the narrower lumen, there will also be some eddies that form, where blood pools or circulates and does not move quickly. As a result, you will have a much larger distribution of velocities that can be measured with our ultrasound, which will come into play as we explore the applications of Doppler later on. We can see this with atherosclerosis, aneurysms, thrombi, thromboemboli, or sometimes even just with kinks or devices that are present in otherwise normal vessels. The key to vascular ultrasound utility lies in the use of Doppler effect to gather information about the vessels we're investigating. So let's review the basics of the Doppler effect. As a reminder, the Doppler effect refers to a perceived change in frequency caused by an object in motion. The classic example is the way a siren seems to grow higher pitched as it approaches you as you stand still on the street watching an ambulance drive by. Then hear the pitch begin to drop as the ambulance passes you and moves away from you. Though that's the classic example, Doppler technology is prevalent in many aspects of our lives, from radar guns to weather radar, and even in the natural world. When blood flow is detected by Doppler ultrasound, some basic conventions are applied. If the direction of flow is towards the probe, the resultant perceived frequency shift moves to a shorter period, assigning a positive velocity value on displays of Doppler shifts. And it's also assigned the color red on color Doppler. In contrast, flow away from the probe results in a perceived lengthening of the frequency pattern, is assigned a negative value, and assigned the color blue on color flow. Vascular ultrasound depends on being able to make accurate measurements. And to do so, the flow being measured should be as close as possible to a vector that's parallel with the angle of inclination. However, this isn't always feasible, and nor is asking me to do any trigonometry since I was in the 10th grade. Thankfully, our machines can do the math for us, but we do have to indicate the direction of flow in a vessel by manipulating the Doppler angle parameter on our machine, so that the indicator is in line with the long axis of the vessel. Ideally, the Doppler angle should be minimized and at least less than 60% or 60 degrees, for the best measurements. We'll go over this in a little bit more detail later. Similarly, I've explained previously the relationship between the pulse repetition frequency and the Nyquist limit in our ultrasound physics module. But as a reminder, remember that the Nyquist limit is the upper limit of velocity that can be accurately measured by the Doppler effect. If we try to sample a blood vessel whose flow velocity is higher than the Nyquist limit, we may notice aliasing artifact appears. Once again, we're going to go over this in more detail at a future lesson. For macroscopic objects, like your car being hit by a radar gun, when we measure a Doppler shift, it gives us a pretty discrete single frequency and thus a single velocity measurement. But think about how small your blood cells are and just how many of them you have moving through your blood vessels. We can't really target one single blood cell. Our ultrasound waves will encounter a lot of these structures and cells along the path that we're insonating. And each of those interactions is going to produce an echo. While we might have a cluster of returning echoes that all show similar Doppler shifts, there's still going to be some variation from one cell to another. And this means that there will be a range of velocities that come back and are mapped out by our returning echoes. Most of the time, this will all be averaged out. But if we care to look at some of the detail in the data, we can sometimes gather more intricate information about the vessels we're insonating. Doppler ultrasound comes in several flavors, and you may hear all of these terms as you study medical ultrasound uses. In broad strokes, we can define our Doppler mode by describing the sampling method we're using, and we can also direct this information to be displayed and interpreted in different ways on our ultrasound machine. You may be familiar with some of these terms, but I suspect that some may be a bit more foreign. Don't worry too much about that just yet. For now, I just want to point out that there are lots of flavors of Doppler ultrasonography. Our next lecture will explore them in depth and help you learn how you might choose a particular sampling method or display choice to fit a particular clinical application. If it seems daunting, don't worry. I promise I'll explain everything in our next lecture. For now, I just want to point out one crucial detail that impacts all of these decisions. And again, we will look at this detail again in our next lecture. This detail is that due to limitations inherent to the process of measuring Doppler shifts, we can choose to prioritize whether we want to gather information that gives us highly accurate velocity measurements or information that gives us highly accurate information about where those echoes are being generated in the body, or in other words, the location of that flow. Choosing a particular flavor of Doppler will prioritize one of these things over the other. That just about wraps up this brief introduction, but then the next lesson will cover Doppler ultrasound in depth, so strap in for some physics. I'll see you then.